Why should you trust these guys? I've had the opportunity to work and get to know these guys over the course of the last, several months. And I am so excited about this next chapter in healthcare because of both of you. I'm so excited to be a part of this and be able to show what you've been working on. So I personally trust you, but let's talk to the listeners at home. Like, why should we, with you guys who've put in all this work, Texas Best Stocks, why should they trust that you're giving them that information?
All right. Well, we have been in healthcare now for 20 years?
40 collectively.
Yeah. Wow. Okay. So we cut our teeth actually in the recruiting world. So bringing doctors into systems and hospitals, and we figured out how that dynamic worked and which doctors were the best fit for which situations. But that's evolved into both of us taking administrative roles in different groups and different types of specialties.
Yeah, Barry?
Yeah, I've been in healthcare for, like Chad said, 20 years, both on the hospital side, physician practice side. A lot of brands that Texas residents would recognize with Baylor and Texas Health Resources, such as that, and still working with physicians today. And so we really wanted to put that knowledge together to try and bring something to the market that we felt like was missing. And so that was kind of the brainchild behind the why behind Texas Best Stocks.
Yeah,
they should trust it because it's coming from the Texas Medical Board. So it's, in a way, not coming directly from us. Mm-hmm. We're just navigating that for you and making that lift a lot easier. But also because we want to be in a world where we can help people. Mm-hmm. We've reached high heights in healthcare, personally and professionally. I think the next legacy for us is to do something that can help people that we'll never meet. Yeah. And that's what's meaningful for us right now, is to do something that's a minimal cost. It's less than Netflix for a premium account. And it's very affordable for physicians to have a premium account. But we know this information will help people in their care decisions, mm-hmm. and that's something we can be proud of and our families can be proud of.
And that's part of the reason why we did this. And it's not just, right now we're just working on transparency with the board actions, but both Barry and I have gone down to Austin to legislate and to testify for different pieces of making transparency easier in healthcare, especially here in our own state. And this is just the beginning of it. I mean, we really want to make it so that you as the patient or you as a referring physician are in power.
We're not just a website, we're a movement. We're going to start a campaign of transparency in healthcare, not just for Texas, but ultimately for Americans, because we believe the information's out there. And as citizens, we deserve this information. Our families deserve this information, so we can make better educated choices for them.
And let's go, and let's go a step further, mm-hmm. because Barry and I both work with providers now. Healthcare is built on a foundation of trust. Those patients come to you because they trust you. Mm-hmm. They believe that you have their best interest in mind.
Yeah.
Because ultimately what we're trying to do here is not just point out the bad doctors. We want you, when you're going to the doctor, either for you, your kids, your husband, your parents, your in-laws, to feel confident in the doctor that you're going to. And the reason why that's so important, this is so important, and it's understated, unfortunately, in medicine. But the more you trust your doctor, the more likely you are to follow their medical advice. If you follow their medical advice, you're more likely to have the results that you need to get your life better, to get your health mm-hmm. better. And so by empowering you to trust your physician, it's the best thing that we can do to help you be as healthy as possible.